Pelvic floor dysfunction is something nobody wants to talk about at parties, but it happens all the time. People are embarrassed to report it. This is your pelvic floor. Isn't that a cool bone? But there's a sling actually at the bottom that holds everything up. The uterus, your colon, your bladder, everything is held together and supported by that network of muscles down there. When they become weak, when they become stuck, when they become painful, if they get scarred down, if they get contracted, nothing works. Inside that muscle layer are what we call sphincters. They clamp down around the urethra and the vagina and the rectum, but they keep everything in until your timing, so you get to be in control. The best thing I do for my patients is provide education about how it normally works. Your bladder sits right in here, right behind your pubic bone, and it works so fabulously. When the bladder stretches, it sends a message to your brain. Your brain sends a message back to these muscles and says, is it the right time? Is it the right place? Can we go to the bathroom yet? If it's not, then the muscles tighten up. They have a reciprocal relationship with your bladder. So as soon as you tighten up your pelvic floor because it's not the right time, it relaxes your bladder. So sometimes you get an urge to go and you kind of pull in, the urge goes away. You don't want to do that too much though, because if the urge goes away too often, then your bladder gets really full and it doesn't think you want the signal anymore. And so then you got 2.4 seconds to get to the bathroom before you got a problem. There's the opposite problem. If you go every 30 minutes, then your bladder thinks that you want that signal every 30 minutes. So you have 2 teaspoons of urine in there and your bladder gives you this crazy urge and you find yourself running to the bathroom. So with a little bit of education about how it normally works, we can solve both those problems for people, just retraining their bladder. The moral of the whole thing is when you have to go, go, and when you don't have to go, don't go. So your bladder gets a signal. It needs to depend on the stretching and the nervous signal that it's getting from your brain. So when you come in, we have to check those muscles, and so sometimes it's kind of an intimate treatment. Go in and test the muscle strength, be sure the muscles aren't painful, be sure they're not stuck. If they are, that's actually a really great finding because I know how to fix that. You go in, massage the muscles, you move them through the entire range of motion, you do exercises to strengthen them up, and the problem gets better. And then you know how to maintain it, and you don't have to come see me. The one thing, the message I would love to get through to people is that it is not normal. There's nothing normal about incontinence. I don't care if you're 22 or 82. There's nothing normal about that. That means that you have something that should be addressed, or that you have poor bladder habits, or you might be eating or drinking something that keeps your bladder irritated. There's something that can be done about those things. Because your bladder sits right behind that pubic bone and your uterus is right behind it, normally that's not a problem, but as the baby grows, the uterus laps over top of your bladder and pushes it against that bone. That's what we call transient incontinence, which means hopefully when you have the baby it'll go away. There are other kinds of transient incontinence. If you have a urinary tract infection, if you've had surgery, especially abdominal surgery, if you've had a hysterectomy, if even the old gallbladder surgeries, lady will come to me and they've got a big scar. You can see where they had they actually had an incision and things are scarred down and not moving, and those ladies get a lot of benefit out of the treatment. Incontinence is huge. I mean, it should be obvious because there's a whole industry of incontinence products. So if you've got incontinence, you're not the only one. Please be rest assured. Incontinence, defined, if you look it up in the dictionary, it's anything that keeps you from voiding where you want to void and when you want to void. So it could be things like pelvic floor weakness. It could be a surgery that's so painful, like you broke a hip and you're in bed and you can't get to the toilet. That's also incontinence. That's kind of a functional incontinence. People who have cognitive deficits, like maybe right after a stroke, or maybe someone who has a little bit of developmental delay, even in children, then your brain's not giving the muscles the signals when they need to, and that's a kind of incontinence. But the ones that we're talking about and the people that I get to meet every day and get to help are the ones that have muscle weakness or usually the surgery. And so when they come in, they kind of look at me like they're powerless. It's going to come anytime. They can't go out to lunch with their girlfriend. They don't even like to go to the doctor because they're not really sure if they're going to get there in time or if they're going to be embarrassed by this. The initial eval will come in and decide exactly what's going on. Sometimes the muscles are strong, but they're not coordinated. So we can give you exercises to do at home where you're taking those muscles through the whole range. If they're stuck, there's some manual treatment we need to do to loosen them up. If they're adhered to the bone or if they're adhered to the bladder, we can go in and loosen them up. Most people don't know that at night you should be able to go 6 to 8 hours at night. People who get up all night, their bladder is confused. It doesn't know whether it's daytime or it's nighttime. At nighttime, your kidneys go into hibernation, just like your respiration slows down and your brain activity slows down, your digestion slows down. Your kidneys are supposed to slow down, so your bladder's not supposed to fill. But if you're up and down all night to the bathroom, your kidneys don't know what time of day it is. So if I just tell them, okay, you wake up, you do 10 Kegels, get rid of that urge, you know, then after a little while, your kidneys figure out, oh no, it's nighttime. And then the problem goes away just with that. So most of the treatments that we do is education. And a lot of times they'll come back and half of the problem is gone before we ever have to start the physical part of the treatment. A lot of these folks, they cancel 2 or 3 appointments because they're, just like they cancel everything else, they're scared they're going to come in and be embarrassed. So they come in, they get a little bit of education, they feel empowered, and they're able to go. I mean, there's one lady, she told me, I don't even want to walk down my driveway to the mailbox. She said, the fact that I'm here is the greatest compliment to you because I don't go anywhere. So their social lives bloom. They have, you know, restored relationship with their family. The implications are so far-reaching. I'm not even sure I'm aware of all of them. If they can talk about it with their doctor and let their doctor know they'd like to try this, or maybe it'd be a recommendation from the doctor, then he needs to write a referral. And the doctor or the patient can call in here and make an appointment and fax over the referral or bring it with them. I really am excited to do this program, and I've spoken several places, and I'm always excited because people are interested and they ask a lot of questions, and it's something that people have a lot of personal experience with, and they're just waiting for me to answer that question so they don't have to ask it. And that's really satisfying. And by the time we're done, you know, people feel like there's hope for this. This isn't something you have to live with for the rest of your life. It's not normal. If you have this and you talk to your doctor, there's something he can do. He will do tests before he sends you to me to rule out some other things that it could be, to make sure that, you know, the structures are still in there where they're supposed to be and there's no pathology, you know, there's no cancer or those kinds of things. But in a lot of cases, it's just simply muscle weakness. It's just simply muscles that don't move or aren't coordinated. And that's what I do. And they come in and they leave more functional, more independent, and less embarrassed. And it's really funny because by the time we're done, they can talk about anything. And they can tell their friends, oh, you got to go see this girl, you know. And she's going to do this and she's going to do this. But don't worry, it's all going to be helpful.